Course Overview. Welcome to EarthTab Business School. My name is Kwesi Asare, and I will be your course preceptor for the course Phlebotomy Certification. Phlebotomy is a vital component of diagnostic healthcare services, forming the bedrock of laboratory testing and patient-centered specimen collection. The Phlebotomy Certification Program is a comprehensive, structured, and industry-aligned curriculum meticulously designed to prepare aspiring phlebotomists with the core competencies, technical precision, ethical grounding, and communication skills required to function efficiently and safely within healthcare teams in both hospital and non-hospital settings. This program emphasizes a holistic, evidence-based, and regulatory-compliant approach to phlebotomy practices in accordance with international standards and regional regulations, including CLIA, OSHA, CDC guidelines, and the European Union's IVDR framework. It is specially curated to prepare candidates for both certification exams and real-world clinical challenges, thereby enhancing their employability and professional advancement. Core learning objectives. By the end of the program, you will be able to demonstrate mastery in venipuncture, capillary sampling, blood culture collection, and point-of-care testing, POCT. Identify and use phlebotomy equipment such as evacuated tube systems, ETS, winged infusion sets, lancets, and vacuotainers accurately. Implement and adhere to infection control protocols, biohazard waste management, and standard precautions. Execute pre-analytical patient preparation and specimen integrity preservation, labeling, handling, transport. Apply legal, ethical, and professional conduct standards, including patient confidentiality, informed consent, and patient rights. Understand the structure of the circulatory system, blood components, and lab tests related to phlebotomy, CBC, LFTs, ESR, etc. Navigate and resolve patient complications such as hematoma, syncope, or difficult veins. Communicate effectively with diverse populations, including pediatric, geriatric, and high-risk patients. Utilize electronic health records, EHRs, for test requisitions, lab interfacing, and documentation. Prepare for certification and licensure through simulated exams, practical assessments, and clinical reviews. Target audience: aspiring healthcare assistants and technicians, pre-nursing, pre-med, and biomedical science students, medical laboratory assistant trainees, international healthcare professionals seeking EU, UK, US certification, healthcare workers transitioning into diagnostics and lab services. Practical are clinical requirements: minimum of 30 supervised venipunctures, minimum of 10 capillary blood samples, observation of lab processing, tourniquet application and complication management, participation in mock exams and clinical skills lab, submission of clinical logbook and skill checklist. For accreditation, alignment, and compliance. This course is built to align with the following standards for international and national certification bodies: Standard Organization Compliance, Features, CLSI, Clinical and Laboratory Standards Institute, Quality Control, Collection Protocols, Lab Safety, OSHA, Occupational Safety and Health Administration, Infection Prevention, Needle Safety, PPE, NHA, AMT, ASCP, US certification bodies. Exam-aligned curriculum, practical exposure, IVDR, EU in vitro diagnostic regulations, patient safety, documentation, lab interfacing, UK OFQUAL, RQF Level 3 competency, regulated framework, credits for further studies. Note: course documentation, assessments, and skills logs are structured to satisfy audit trails for both academic and workplace certification. Assessment format: assessment type weight, quizzes and MCQs 20%, practical skills, logbook 25%, clinical practicum supervisor rating 25%, final certification exam 30%. Graduation outcome and pathways. Upon successful completion, you will be awarded a phlebotomy technician certificate, qualifying them to sit for certification exams, NHA CPT, AMT RPT, ASCP PBT, apply for entry-level phlebotomy roles in hospitals, laboratories, blood donation centers, and clinics, progress into medical laboratory technology, nursing, or diagnostic imaging programs. Delivery mode, hybrid, online plus in-person. Video tutorials, downloadable manuals, e-assessments, and life skill workshops. Access to digital labs, anatomy simulations, and practice quizzes. Global relevance. This certification is recognized or applicable in USA, UK, Canada, Germany, Netherlands, Ireland, Australia, UAE, and across the European Union. I look forward to congratulating you upon completion of this course.